Good afternoon, everyone. My name is Shannon McFadden, and today I'm sharing my presentation titled Adolescent Substance Use, Understanding Risk, Resilience, and Implications for Counseling Practice. This subject hits particularly close to home for me, especially in the context of my practicum, where I work with adolescents in grades 7 through 12. Before I begin, I would like to acknowledge that I'm delivering this presentation from the coastal inland territory of the Tsimshian people, where the stewards who have been caring for the lands and waters are from the Kitsillis and Kitsam-Kalam nations. Today's presentation will begin with a brief introduction and an outline of the scope of the problem. We will then explore the development of the adolescent brain and the risk factors that contribute to substance use and abuse. We will look to consequences, co-occurring mental health disorders, protective factors, evidence-based prevention and treatment, implications for practice, and ethical and cultural considerations. The presentation will conclude with key takeaways and some questions for reflection and discussion. Okay, so today I'll be discussing adolescent substance use and adolescent substance use disorders, including why adolescence is such a critical developmental period, the factors that contribute to substance use, the consequences for young people, and the implications for counseling. When discussing adolescent substance use, it's important to distinguish between substance use and substance use disorder. Substance use simply refers to the consumption of substances such as alcohol, cannabis, nicotine, prescription drugs, or other drugs. In contrast, a substance use disorder, or an SUD, involves a problematic pattern of use that leads to a significant impairment or distress, as defined in the DSM-5. Adolescence is a unique developmental period characterized by major biological, psychological, and social changes. People are developing their identities, seeking greater independence, and navigating increasingly complex relationships. Although adolescence is commonly defined as occurring between the ages of 12 to 18, neuroscience is telling us that important aspects of brain development continue well into our mid-20s. Because these developmental changes, substance use often presents differently in youth than it does in adults. Early warning signs can include declining academic performance, conflict with caregivers, changes in peer groups, or increased risk-taking behaviors, rather than the obvious signs of dependence. Understanding these developmental differences is essential for prevention, early intervention, and effective counseling practice. Okay, so the scope of the problem. Adolescent substance use is a significant public health concern with consequences that extend beyond the individual to families, communities, and society as a whole. In the short term, substance use is associated with increased risk-taking behaviors, including unsafe sexual activities, accidents, school difficulties, and involvement with the justice system. Over time, early substance use increases the likelihood of developing a substance use disorder and contributes to poor mental and physical health outcomes. In Canada, youth aged 15 to 24 report some of the highest rates of substance use and substance use related disorders. Alcohol remains the most commonly used substance, followed by vaping and cannabis. Rates generally increase with age, with grade 12 students reporting the highest levels of use. Gender diverse youths and students living in rural communities report higher rates of several forms of substance use, including vaping, prescription medication misuse, illegal drug use, and polysubstance use. Many adolescents report that alcohol and cannabis are actually really easy to obtain through family members and friends, emphasizing the important role of social and community influences. What makes this issue particularly important is that over 90% of adults with substance use disorders began using substances at adolescence. This means that adolescence is not only a period of increased risk, it's also our greatest opportunity for prevention and early intervention. The key message here is that intervention during adolescence has the potential to alter the trajectory of a young person's life. Now, let's take a closer look at the adolescent brain. To understand why adolescents are particularly vulnerable to substance use, we first need to understand what's happening in the adolescent brain. The adolescent brain is still developing, particularly the prefrontal cortex, which is responsible for planning, decision making, impulse control, and considering long-term consequences. At the same time, the brain's reward system develops more rapidly. This creates what researchers describe as an imbalance between reward seeking and self-regulation. One analogy I found that illustrated this for me better was that adolescents have fully functioning gas pedals, but really underdeveloped brakes. So as a result, adolescents are more likely to seek novelty, take risks, and pursue rewarding experiences while having less capacity to regulate those impulses. This process is closely tied to dopamine, a neurotransmitter involved in motivation, reward, and pleasure. Many addictive substances trigger large releases of dopamine, reinforcing continued use and increasing vulnerability to dependence. Environmental experiences can further amplify this risk. Exposure to trauma, family conflict, abuse, neglect, and chronic stress can alter brain development and increase sensitivity to addictive substances. The literature generally organizes risk factors into 4 broad categories: family and social factors, individual factors, cultural considerations, and structural or environmental factors. Okay, so family, community, and social risk factors. Family experience plays a major role in adolescent substance use. Research identifies childhood maltreatment, parental substance use, poor parent-child relationships, family socioeconomic challenges, and perceived parental approval of substance use as important risk factors. Children who experience physical or sexual abuse are significantly more likely to use substances during adolescence. Chronic stress associated with trauma can also affect brain development, increasing vulnerability to both substance use and addiction. Social influences are equally important. Peer pressure, bullying, gang affiliation, and association with substance-using peers all increase risk. Because adolescents place high value on peer acceptance, they may engage in substance use to gain social status or to fit in with their peer group. All right, so let's look at individual risk factors. While family, peer, and environmental influences can play a significant role in adolescent substance use, certain individual characteristics can also increase vulnerability. Mental health conditions such as depression, anxiety, post-traumatic stress disorder, ADHD, and conduct disorders have all been linked to increased risks of substance use. I will discuss these a little bit more on a later slide. Many adolescents report using substances to regulate emotional distress, manage symptoms, or escape difficult experiences. For others, there is a high value placed on fitting in, seeking acceptance, and finding a sense of belonging. During this stage, peer relationships can become especially influential, and the desire to be accepted may lead some youth to experiment with substances or engage in risky behaviors. Understanding these developmental needs helps us to see that substance use is often about much more than the substance itself. It can also reflect a young person's search for identity, connection, and belonging. All right, let's look at some cultural considerations that can be considered risk factors. For Indigenous youth, the impacts of colonization, residential schools, and intergenerational trauma can contribute to increased vulnerability. Historical and ongoing disruptions to family systems, cultural identity, and access to resources continue to affect many youth and communities today. Further research has found that bullying and othering of LGBTQ2+ youth are additional risk factors for substance use. Disproportionate stigma and discrimination experienced by LGBTQ2+ youth have been shown to result in large disparities in substance use rates among high school students. Understanding substance use within this broader context highlights the importance of culturally safe, trauma-informed, and strengths-based approaches to prevention and intervention. We'll discuss a little later how culture can also be a powerful source of resilience and protection. Okay, and our final risk factor is structural and environmental. So broader social and environmental conditions can also influence adolescent substance use. Poverty, housing instability, limited access to mental health and addiction services, and the availability of substances within a community can increase risk. These challenges can be particularly pronounced in rural and remote communities, where youth often face barriers to timely support or making the decision to leave their families and their homes and their communities for the required support. Structural factors such as colonialism, systemic inequalities, and socioeconomic disadvantage can further compound risk and contribute to substance use as a coping strategy. These factors often interact with family, cultural, and individual influences to shape a young person's overall level of risk. Consequences of adolescent substance use. Understanding the risk factors helps explain why some youth begin using substances. So the next question I wanted to ask is, what are the consequences? Substance use during adolescence can affect nearly every area of functioning. Youth who misuse substances are more likely to experience academic difficulties, school suspensions or expulsions, involvement with the justice system, mental health challenges, unemployment, and continued substance use into adulthood. Because the brain is still developing, substance use can interfere with memory, attention, learning, and executive functioning. Research suggests that alcohol and drugs may have greater impact on the adolescent brain than on the adult brain, particularly in the regions involved in memory and decision making. Early substance use is especially concerning. Research demonstrates that youth who begin using substances before the age of 14 are at significantly increased risk for developing substance use disorders later in life. These findings reinforce the importance of prevention and early intervention efforts. And finally, one of the consequences I didn't particularly want to touch on, but it is commonly in the news and is a very real part of this, is overdose risks and mortality concerns. All right, co-occurring mental health disorders. Substance use rarely occurs in isolation, and this is a really important piece of this puzzle. Common co-occurring conditions, as I've mentioned before, include depression, anxiety, post-traumatic stress disorder, ADHD, and conduct disorders. And for those who aren't familiar with this, and it was new to me, conduct disorders are a mental health condition characterized by a persistent pattern of aggressive, defiant, or rule-breaking behaviors that violate the rights of others or social norms. Youth with conduct disorders are at increased risk of early substance use and substance use disorders. In many cases, these conditions develop before substance use begins, making them important risk factors. Youth experiencing depression, anxiety, or trauma-related symptoms may use substances as a form of self-medication. Similarly, adolescents with ADHD or conduct disorders may be more vulnerable due to impulsivity, executive functioning challenges, and increased risk-taking behaviors. Importantly, the relationship is often bidirectional. Mental health concerns can increase the likelihood of substance use, while substance use can worsen existing psychological symptoms. This highlights the need for integrated treatment approaches that address both substance use and mental health concerns simultaneously. Okay, let's look at some protective factors. So while risk factors are important, they only tell part of the story, especially from a clinical perspective. Protective factors help explain why some youth thrive despite significant adversity. At the family level, strong parent-child relationships, effective communication, emotional support, and consistent supervision can all reduce risk. Socially positive peer groups, school connectedness, supportive adults, and a sense of belonging are associated with lower risks of substance use. Individual protective factors include optimism, resilience, mindfulness, healthy coping skills, and a positive sense of identity. Cultural factors are also important. Strong cultural identity, connection to community, traditional practices, spirituality, and relationships with elders can all serve as protective factors, particularly for Indigenous youth. Finally, participation in structured extracurricular activities, access to positive role models, and engagement in school can provide opportunities for connection, competence, and health development. The more protective factors a young person has, the more resilient they tend to be when facing challenges. Building on these resilience factors, let's talk a little bit about evidence-based prevention. So we've explored the factors that contribute to adolescent substance use. It's also important to consider what works in preventing and treating these concerns. Research suggests that prevention is most effective when it begins early and involves multiple areas of a young person's life. Schools provide an important opportunity to teach life skills, increase awareness, and identify youth who may be at risk. Families also play a critical role. Positive parent-child relationships, effective communication, and consistent supervision have all been demonstrated to reduce the likelihood of substance use. And finally, community-based prevention comes in many forms, and in particular, recreation opportunities, harm reduction education, culturally appropriate experiences, and accessible supports have all been demonstrated as successful avenues for prevention. When an adolescent requires treatment for substance use, research consistently shows that there's no single intervention that works for everyone. Instead, the most effective treatment is comprehensive, developmentally appropriate, and tailored to the young person's individual needs. One of the strongest evidence-based approaches is family-based therapy. Adolescence exists within a family system, so involving parents or caregivers when it is safe and appropriate can strengthen communication, improve relationships, increase accountability, and create a more supportive home environment. Rather than focusing solely on the adolescent, these approaches recognize that a lasting change often requires support from the people who are most involved in a young person's daily life. Another well-established intervention is cognitive behavioral therapy, or CBT. CBT helps adolescents recognize the connection between their thoughts, emotions, and behaviors. They'll learn to identify unhelpful thinking patterns, develop healthier coping strategies, improve emotional regulation, and build practical skills for managing stress, peer pressure, and difficult emotions without relying on substances. Motivational interviewing, or MI, is also widely used with adolescents because many young people are not initially ready or willing to change. Rather than confronting or persuading them, MI takes a collaborative, non-judgmental approach, and it helps adolescents explore their own ambivalence, identify their personal reasons for change, and build confidence in their ability to make healthier choices. This approach respects the adolescent's growing autonomy while supporting intrinsic motivation. It's also important to recognize that substance use rarely occurs in isolation. Many adolescents experience substance use challenges are also living with anxiety, depression, trauma, ADHD, or other mental health concerns that we've talked about previously. Because of this, integrated treatment is considered to be best practice. Addressing substance use while also addressing the underlying mental health concerns often results in poor outcomes. Closely related is the importance of using trauma-informed approaches. Many youth who use substances have experienced adverse childhood experiences, abuse, neglect, loss, or other forms of trauma. Trauma-informed care shifts the question from "what's wrong with you?" to "what happened to you?" and what were substances helping you, avoid or feel safe around, or those kinds of questions. It emphasizes creating emotional and physical safety, building trust, collaborating with the young person, and empowering them to participate in decisions about their care. This helps reduce shame and supports engagement in treatment. Overall, the literature consistently demonstrates that the strongest outcomes occur when family involvement, mental health treatment, and substance use interventions are combined, rather than delivered separately. This holistic approach recognizes the complexity of adolescent development and the multiple factors that contribute to substance use. Finally, it's important to acknowledge that these evidence-based treatments are not equally accessible to all youth. In rural and remote communities, like the one I live and work in, families often face significant barriers to care. Specialized services may only be available in larger city centers, requiring long travel distances, time away from school and work, and separation from family supports. There are also financial costs associated with travel and accommodation, and in small communities, concerns around privacy and stigma can discourage youth from seeking help. These realities remind us that effective treatment is not only about knowing what works, it's also about ensuring that young people can actually access those services. Implications for practice, developmentally appropriate and relationship-based care. When working with adolescents, it's important to remember that they are not simply small adults. Their brains are still developing, as we've mentioned, particularly in the prefrontal cortex, which is responsible for attention, emotional regulation, decision-making, and impulse control, making adolescents, as we said, more vulnerable to impulsive and risk-taking behaviors. Recognizing this developmental reality allows us to view substance use through a compassionate developmental lens, as opposed to assuming adolescents are simply making bad choices. Another important consideration is that adolescents often enter treatment or therapy under very different circumstances than adults. Many are referred by parents, schools, physicians, or the justice system rather than seeking help on their own. As a result, they may arrive feeling resistant, defensive, or uncertain about who they are. Their goals may not align with those of their parents or other adults involved in their care. Rather than expecting immediate motivation for change, it's our role to meet the adolescents where they are and gradually help them discover their own reasons for engaging in treatment. Because of this, treatment should focus on skill building rather than punishment. Adolescents benefit from learning practical skills such as emotional regulation, healthy coping strategies, communication, problem solving, and decision making. Using developmentally appropriate language, activities, and interventions makes treatment more engaging and increases the likelihood that new skills will be retained and used outside of therapy. Psychoeducation is another valuable component of treatment. Helping adolescents and their families understand how the adolescent brain develops can normalize many behaviors while reinforcing that growth and change are possible. Understanding that impulsivity, emotional intensity, and risk-taking are all influenced by brain development can reduce shame and blame while increasing empathy and encouraging families to focus on support rather than punishment. Perhaps the most importantly, one of our primary tasks as counselors is building engagement. Research consistently shows that the quality of the therapeutic relationship is one of the strongest predictors of successful treatment outcomes, particularly for adolescents. Before young people are willing to examine difficult behaviors or make meaningful changes, they need to feel safe, respected, understood, and most importantly, genuinely heard. This means approaching adolescents with curiosity and not judgment. It means respecting their growing autonomy, inviting them into shared decision-making whenever possible, and avoiding unnecessary power struggles. Instead of positioning ourselves as the expert who tells them what to do, we work collaboratively alongside them, helping them identify their own strengths, goals, and reasons for change. A phrase that stood out to me throughout the literature was that connection often precedes correction. In other words, meaningful change is far more likely to occur when a young person's first experience a trusting, supportive relationship. Once that connection has been established, adolescents are much more willing to engage in difficult conversations, develop new skills, and begin making healthier choices. With adolescents, practice must also be holistic, addressing mental health, family relationships, peer influences, school functioning, and cultural identity alongside substance use. A trauma-informed lens is essential, and adolescents presenting with substance use or substance use challenges should be screened for co-occurring mental health concerns such as depression, anxiety, PTSD, and ADHD, so substance use and mental health concerns can be treated together. Rather than asking, what's wrong with youth, this youth specifically, we might ask, what happened to this youth, or what are they struggling with, and how has substance use helped them cope? Finally, treatment should focus not only on reducing substance use, but also on building resilience, connection, identity, and hope as protective factors. These can include healthy relationships, emotional regulation and coping skills, cultural identity and connections, social engagement, extracurricular activities, hope, strength, and future goals, among others. Some key ethical considerations. Working with adolescents also presents a number of unique ethical challenges. Unlike many adult clients, adolescents are still developing cognitively, emotionally, and socially, which means counselors are often balancing competing ethical responsibilities rather than making straightforward decisions. One of the most significant ethical considerations is balancing protection with autonomy. Adolescents are considered a vulnerable population, and many require additional support or protection, particularly when substance use places them at risk of harm. At the same time, they're developing the capacity to make informed decisions about their own lives and healthcare. As counselors, we have an ethical responsibility to respect and encourage that emerging autonomy while also ensuring their safety. Finding the right balance is rarely simple and often requires careful clinical judgment. Confidentiality is another key consideration. Developing trust is often the foundation of successful counseling with adolescents, and many young people are only willing to discuss substance use if they believe their privacy will be respected. However, confidentiality is not absolute. Counselors must also consider situations involving significant harm, mandatory reporting requirements, or circumstances where caregiver involvement is necessary to protect the adolescent's well-being. Being transparent about the limits of confidentiality from the beginning helps build trust while preparing youth for situations where information may need to be shared. Questions around informed consent can also be complicated. Although many adolescents are capable of making informed decisions about treatment, decision-making capacity really depends on the individual's maturity, understanding, and ability to appreciate the consequences of their choices, not simply their age. Factors such as substance use, trauma, co-occurring mental health conditions, may temporarily affect this capacity, requiring counselors to continually assess a young person's ability to provide informed consent throughout treatment. Finally, the principle of beneficence, or acting in the client's best interest, can sometimes come into tension with respect for autonomy. As clinicians, we naturally want to protect young people from harm, and there may be times when we believe involving caregivers, recommending treatment, or encouraging certain decisions is the safest course of action. However, ethical practice also requires us to respect adolescents as active participants in their own care, whenever possible. Rather than making decisions for them, we aim to involve them in the decision-making process, helping them understand options, weighing risks and benefits, and develop the capacity to make informed choices. In many cases, the most ethical approach is one that balances safety with empowerment, recognizing that both are essential for healthy adolescent development. Ultimately, ethical practice with adolescents is rarely about choosing one principle over another. It's about thoughtfully balancing autonomy, beneficence, confidentiality, and safety in a way that supports both the young person's immediate well-being and their long-term development. So, putting into context some of these ethical considerations that I brought forward, I wanted to bring a scenario for discussion that came up in one of our supervision sessions this week. So, a 14-year-old client discloses ongoing substance use and asks for support to access harm reduction services. They explain that their parents strongly oppose harm reduction and do not want them to receive these supports, as they really believe their family can handle it on their own. As their counselor, how would you proceed, and what ethical principles would help guide your decision? Feel free to include this in some of your posts this week for discussion. Culturally responsive practices are equally important. Culture can influence both vulnerability and resilience for adolescents. While experiences such as discrimination, acculturation stress, and intergenerational trauma may increase risk, strong cultural identity, belonging, spirituality, and community connection can really serve as powerful protective factors. For counselors, this means approaching youth with cultural humility, adapting interventions to align with cultural practices and values, and recognizing culture as a potential source of healing and resilience. Effective interventions that can be tailored to clients' cultural contexts and lived experiences are demonstrated to be much more effective. So in conclusion, I'm going to just summarize some of the key takeaways from my presentation. The first is that adolescent substance use is not simply the result of poor choices, but rather the product of an interaction between neurodevelopmental, psychological, social, and environmental influences. Because substance use and mental health disorders frequently occur together, effective treatments for adolescent substance use should address both issues simultaneously through integrated, trauma-informed, and developmentally appropriate approaches. Substance use prevention is not just about reducing risk factors, it's also about strengthening protective factors across individual, family, community, cultural, and structural domains. Counseling with adolescents must keep in mind that they are not tiny humans, but rather humans in a unique neurodevelopmental stage that requires consideration in clinical practice. Evidence suggests that most effective interventions are those that are trauma-informed, including strong therapeutic alliances, involved families, building coping skills, addressing other mental health concerns, and intervening early before substance use becomes more severe. Ethics when working with youth and substance use must balance autonomy and protection. And finally, culture can influence adolescents' vulnerability and resilience, and sessions should be approached with humility and with culturally appropriate interventions applied when appropriate. And now I'd like to present some questions for both reflection and discussion. So the first is, how can a counselor balance a young person's right to confidentiality with the need to involve caregivers' treatment? Next, when, if ever, is it ethically appropriate to involve parents or caregivers in discussions about a young person's substance use? How can we protect young people and promote their well-being without diminishing their autonomy or voice in the treatment process? How can culturally grounded approaches improve outcomes for Indigenous and LGBTQ2+ youth experiencing substance use challenges? And although I didn't explore social media in this presentation, what role do you think it plays in influencing adolescent substance use, both positively and negatively? Thank you everyone for listening, and I'm looking forward to this week's discussion. Take care.